Let me talk to you today as a doctor who has seen far too many good people lost too soon. Not because they were careless or unaware, but because life sometimes hides danger in plain sight. I want you to know about 5 sudden death triggers in the elderly that most people never see coming. These are not just statistics or possibilities. These are real threats that steal lives quietly and quickly. And I want you to be prepared, because knowledge truly is protection. When you understand these triggers, you can act. You can change the course of what might otherwise seem inevitable. Let me begin with something that touches every one of us as we grow older: the heart. Sudden cardiac arrest is one of the leading causes of unexpected death in older adults. It happens when the electrical system of the heart malfunctions and stops the heart from beating properly. Unlike a heart attack, which may give some warning signs, cardiac arrest often comes without any signal at all. The person might be talking one moment and collapse the next. According to the American Heart Association, nearly 350,000 people in the United States experience out-of-hospital cardiac arrest every year, and nearly half of those are over the age of 65. What makes this so tragic is that many of these events are preventable. Uncontrolled high blood pressure, unmanaged cholesterol levels, and untreated arrhythmias are all culprits that can quietly build up to a fatal outcome. The heart is an organ of rhythm and balance, and when it loses that rhythm, life can slip away in seconds. Now let's talk about falls. Yes, a fall, something that might seem like a simple accident, can, in truth, be a deadly trigger. As we age, our bones become more fragile, our reflexes slow, our balance shifts. A fall can lead to fractures, head injuries, internal bleeding, or complications from prolonged immobility like pneumonia or blood clots. The Centers for Disease Control and Prevention reports that falls are the #1 cause of injury-related deaths among adults over 65. That means more people die from complications of a fall than from car accidents or even some cancers in this age group. And yet, many homes are still filled with loose rugs, poor lighting, or stairs without handrails. Medications that cause dizziness or low blood pressure are often overlooked. But every single one of these things is a piece of the puzzle. Protecting yourself or a loved one from a fall is not about fear. It is about being wise. It is about seeing the floor not just as something to walk on, but something to respect. The third sudden death trigger I want to talk about is a silent one, and in many ways that makes it the most dangerous. It is sepsis. Sepsis is the body's overwhelming and life-threatening response to infection. It can come from something as common as a urinary tract infection or a small wound that goes untreated. In older adults, the immune system does not respond as strongly. Symptoms are not always obvious. Fever may be absent. Confusion might be the only early sign. A study published in the Journal of the American Medical Association showed that sepsis is a leading cause of hospitalization and death in older Americans. The frightening part is that time is of the essence. Every hour that treatment is delayed increases the risk of death. We must never ignore sudden confusion, rapid breathing, chills, or extreme fatigue in an older person. These are the body's cries for help, and they need to be answered swiftly. Now let us look at something that is often misunderstood and underestimated: blood clots, especially pulmonary embolism. This is when a clot travels through the bloodstream and lodges in the lungs. It can stop the heart from getting enough oxygen. It can kill in minutes. Older adults are particularly at risk because of slower circulation, less mobility, and medical conditions like cancer or heart failure. Even a long plane ride or sitting too long after surgery can increase the risk. The National Blood Clot Alliance states that nearly 300,000 Americans die from blood clots every year. Most of them are preventable. Warning signs can include sudden shortness of breath, chest pain, rapid heart rate, or leg swelling. But here's the issue. These symptoms are often brushed off, blamed on age, on anxiety, or just ignored. The truth is, you must listen to your body. If something feels wrong, you must seek help. It is not weakness, it is strength, it is survival. Finally, there is a trigger that is both physical and emotional: heat stroke. Extreme heat can kill the elderly faster than most people realize. Older bodies are less efficient at regulating temperature. Medications can interfere with sweating. Chronic illnesses can dull thirst. A person may be overheating and not even know it. During heat waves, hospitals fill with older patients suffering from dehydration, confusion, organ failure, and collapse. A study from the Environmental Health Perspectives Journal found that elderly people are at significantly higher risk of death during heat events. And it does not have to be a record-breaking temperature. It can be an afternoon of sitting in a room without a fan or AC. Hydration, cool spaces, light clothing, and check-ins from friends or family can make all the difference. The tragedy of heat stroke is that it is so easy to prevent, but only if we recognize the risk in time. Now, why am I telling you all this? Not to scare you, but to prepare you. Because aging is not a punishment, it is a privilege. It is the reward of having lived and loved and survived what others could not. But it requires us to be vigilant, to respect the body as it changes, to recognize that danger does not always look dramatic. Sometimes it looks like skipping a blood pressure check. Sometimes it looks like not drinking water because you don't feel thirsty, or pushing through dizziness instead of sitting down, or not calling a doctor because you don't want to be a bother. I have stood by too many bedsides where families whispered, "We didn't know it was this serious." And it breaks something inside me every time, because so many of these sudden deaths could have been prevented with awareness, with timely care, with one phone call, with one question, with one change in a routine. So here is what I want you to remember. Your heart deserves monitoring. Your balance deserves respect. Your infections deserve attention. Your legs deserve movement. Your body deserves hydration. You are not being dramatic. You are being alive. And being alive means protecting yourself with the same love and care you would give to someone you hold dear. Talk to your doctor about an EKG if you have a family history of heart issues. Ask about bone density screening if you have never had one. Understand your medications and their side effects. Get up and walk every hour if you sit for long periods. Keep your house safe and your environment cool. These are not small things. These are life-saving acts. And to those who love someone elderly, I speak to you now. Do not assume they will tell you when something is wrong. Watch, ask, be present. Sometimes the strongest people are the ones who hide their pain the most. There are 5 sudden death triggers: sudden cardiac arrest, falls, sepsis, blood clots, heat stroke. But there are also 5 powers you hold: awareness, action, vigilance, compassion, and courage. Let your courage be louder than your fear. Let your knowledge be your shield. You have earned the right to live these years with safety and dignity, not by chance but by choice. That is what I want you to carry with you. Not just the knowledge of what can go wrong, but the power of what can go right when you know the truth and choose to act on it. Life is fragile, yes, but it is also resilient. With every heartbeat, every step, every drop of water, every hand that reaches out, you are writing your legacy. Let it be a legacy of wisdom. Let it be a legacy of life well lived, protected, and honored. Are you ignoring these subtle signals from your body? Let me speak to you today as someone who has walked the quiet halls of hospitals, listened to the whispers of patients, and watched the subtle shift between a body holding on and one beginning to slip. I want to ask you a question that might just save your life. Are you ignoring the subtle signals from your body? Are you brushing off signs that something might be wrong simply because they do not scream loudly or come with flashing warnings? The truth is, our bodies often speak in a soft voice, a whisper before the storm. And if we learn to listen early enough, we can prevent the storm altogether. Many older adults begin to feel certain changes and think they are just a normal part of aging. A little fatigue, some dizziness, occasional confusion, shortness of breath here and there. It is easy to think, I'm just getting older. That's all. But sometimes those gentle nudges from your body are not about age. They are about danger. They are about your heart, your brain, your lungs, your blood. They are the quiet signals your body sends before it begins to fail. Ignoring them can cost you your independence, your well-being, and even your life. Let me start with something very common but often overlooked. Fatigue, that deep tiredness that does not go away with rest. When an older adult feels more tired than usual, day after day, it can be more than just age. It can be the early sign of heart failure. The Mayo Clinic has documented that heart failure symptoms in older adults often appear gradually, starting with fatigue, especially during simple activities like walking or climbing stairs. The heart is no longer pumping blood efficiently, and so the muscles, including the brain, are not getting enough oxygen. It may not feel dramatic at first, but over time, that fatigue can become disabling. It is not just tiredness, it is your heart asking for help. Now think about dizziness or feeling lightheaded. Have you felt it when you stand up? Or maybe just while walking across a room? Do not dismiss it. Dizziness can be a sign of low blood pressure, irregular heart rhythms, or even small strokes. According to a study published in Neurology, older adults who report episodes of dizziness have a higher risk of falls, hospitalization, and death. The body is warning you that something is not functioning properly. The blood may not be reaching the brain the way it should, and your risk of a fall, which can trigger a cascade of complications, increases dramatically. Another signal that too many people ignore is shortness of breath. If you are getting winded during simple tasks like making the bed or tying your shoes, that is not just aging. That could be early-stage lung disease, anemia, or again, heart failure. Shortness of breath is not something to live with quietly. It is something to investigate. Research from the American Lung Association confirms that many older adults live with undiagnosed COPD or chronic bronchitis, thinking it is just part of growing older. But left untreated, these conditions worsen, reduce your quality of life, and increase the risk of sudden health emergencies. Let me share another common but subtle sign: loss of appetite. Many people over the age of 65 begin eating less and think nothing of it. But a sudden or ongoing lack of interest in food can be your body's signal that something deeper is going on. It can point to depression, thyroid dysfunction, infections, or even cancer. The National Institute on Aging notes that unexplained weight loss is often one of the first signs of serious disease. The body needs fuel to function. When it begins to reject food, that is not something to ignore. That is a conversation you need to have with your doctor. And then there is confusion or sudden changes in memory. A little forgetfulness is common, yes. But when you or someone you love starts to forget names they always remembered, gets lost in familiar places, or suddenly struggles to follow conversations, it can be the beginning of cognitive decline. Or it can be something treatable, like a urinary tract infection or vitamin B12 deficiency. According to research in the Journal of the American Geriatric Society, acute confusion or delirium is often a symptom of an underlying medical issue, not just aging. That is especially true in elderly individuals who become confused during hospital stays or after starting a new medication. The body is trying to tell us something, and that message is urgent. Your body does not shout, it whispers: a small pain here, an extra nap there, a feeling that your legs are a little heavier than they used to be. But all these small things matter. They are not just aging. They are clues. They are signals. And they are asking for your attention. Think about a car. When a small light flashes on the dashboard, we know to check it. But when it comes to our own bodies, we often ignore those lights. We push through. We tell ourselves it will pass. But unlike cars, we cannot trade in our bodies for a new one. We only get one. The Harvard Health Letter once stated something simple but profound. Most major medical emergencies begin with minor signs: a small clot before a stroke, a skipped heartbeat before cardiac arrest, a cough before pneumonia. The key is catching them early, and that takes awareness. That takes listening. That takes not doubting yourself when something feels off. I know many of you come from a generation that believes in being tough, that believes in not complaining, that believes in not making a fuss. But let me tell you this. Speaking up is not weakness, it is wisdom. It is strength. It is what keeps you here longer for your children, for your grandchildren, for the things you still want to see and do. If you take one message from me today, let it be this. Your body is not your enemy. It is your partner. It is trying to help you survive. It gives you signals, not to scare you, but to protect you. When it sends you pain, fatigue, dizziness, or confusion, it is doing everything it can to grab your attention. Do not silence it. Do not explain it away. Listen. Ask questions. Call your doctor. Have a conversation. Do not wait for the problem to become too big to fix. Let today be the day you start paying closer attention. Let it be the day you promise yourself that you will no longer ignore the quiet signs, because every signal your body gives you is a gift, a chance to act, a chance to heal, a chance to live, and that chance is worth everything.